So I wanted to talk a little bit today about briefly causes of infertility and mostly evaluation of the couple. So when I see couples for the first time after taking their history, I'm primarily concerned about three areas of concern. Number one, male factor infertility. Secondly, ovarian dysfunction and ovarian reserve. And thirdly, evaluation of the uterus and patency or openness of the tubes. So back to the initial factor of infertility. When couples have been trying to get pregnant for 1 year, we expect 85% of couples to be pregnant. So if you are not pregnant at 1 year, some of the initial tests that we would like to do are number one, getting back to male factor. A simple semen analysis will tell us about a man's sperm count, motility, and morphology. And those three factors will give us a good indication of his fertility potential or what the concerns are. Secondly, we're looking at ovarian dysfunction. When women have extremely regular periods, it's almost a guarantee that they are ovulating. But a day 21 cycle progesterone, a simple blood test, will confirm that. If a woman does not have regular periods, she is probably not even having a chance every month to be pregnant, and we start looking at ways to help her ovulate. The area of ovarian reserve is a big concern for women. We like to know how many eggs they have available for reproduction. So a very simple blood test called anti-Mullerian hormone indicates this. AMH, or anti-Mullerian hormone, is made by all the resting eggs in the ovary. So on any given day of the cycle, when we do a blood test for AMH, it reflects the number of eggs available to get pregnant with. A normal number that we like for AMH is 1.4 or greater. So if a woman has anything above 1.4, it doesn't have to be much above that. We consider that normal. And numbers that are lower indicate fewer eggs, but certainly does not mean that the couple will not get pregnant. But it does mean that we probably need to move ahead with some therapies. So other than testing for ovarian reserve and semen analysis, the third area we really want to make sure that everything is good with is the architecture of the uterus and the patency of the tubes. So there are two simple tests. One is called a hysterosalpingogram, a simple fluoroscopy or dye study test. It's kind of like an x-ray, where we put a little bit of dye into the uterus, just through the vagina. Feels kind of like what I call the super duper pap smear. And you just occasionally will have a little bit of cramping, but it's a nice look at the shape of the uterus and the openness of the tubes. Another way to look at the uterus is to put a little bit of water into the uterus. It's called a saline ultrasound or a hydrosonogram, just to get an idea if there are any fibroids or polyps that could be affecting implantation of the embryo. So those are just simple tests to do: semen analysis, serum progesterone, anti-Mullerian hormone, and saline ultrasound or HSG.